Good afternoon, doctor. I was thinking about these courses that we're putting on, both online and, of course, the live courses as well. And I realized that they teach what God has given me to give to you. He gave me over 30 years so far of clinical in the trenches practice of pediatric dentistry and orthodontics. This is not just theory. This is real stuff. This is me working to restore decayed teeth in a little 5-year-old autistic boy with mama right beside me, worrying to death about her child, not sure if she's doing the right thing. This is me comforting her with words that come to me to work through and give her the comfort and the child what he needs to get him through and get the job done. And we did. And he and she and I were better than before. This is me looking at a midline in a patient where I've allowed it to shift unknowingly and figuring out what should I try to fix this? What am I going to do? How am I going to go about it? What mechanics should I use? This is me looking at, wait a minute, in the future, we can prevent this and understanding how to probably do that much more of the time than not. And if not, if something happens, then I've learned how we can fix it. And I can teach you that too. This is me when a pedo colleague sends me a patient who has a 12-year molar that's partially erupted, and he has done a large, very large restoration on that erupting tooth. And he takes an x-ray to check it, and he has an open margin, wildly open margin. And he's so discouraged, he doesn't think he can manage it between the patient's behavior, the tongue, the moisture. It's just something that he doesn't even know where to start. So he asked me to see them because that patient's none too cooperative. Let me tell you a story. When I was in dental school as an RN, I was able to go in the evenings to the hospital to cover the house. The hospital house, in other words, all the patients that were there in this community hospital. As the nursing supervisor, I was the last resort to start IVs on patients the other nurses just couldn't get started. Whether it was an infant scalp vein or whether it was an ICU elderly debilitated patient who had almost shut down veins, whatever it was up to me. I had to do it. You know, when it's up to you, you've been in your practice, you've been there when you had to figure something out, when there was no one to help you, and you had to figure it out. And boy, do you get great at it, right? So back to the 10-year-old with partially erupted 12-year molar that now needs a more subgingival restoration than it was done in the first place, of course. Guess what? I got the rubber dam on because I had practiced doing tough ones for years and years and years. And you know what? It took a while on this one, but I got it. And we're able to work and create a really great restoration. Sure enough, it was super. And guess what? He actually did pretty well with his behavior, and I did pretty well with his behavior as well. This is me discovering how to correct a full class 2 occlusion in 4 to 6 months orthodontically in a full ortho patient. And I did it over and over. And discovering that correction of a full class 2 or 3 occlusion even works in mixed dentition. Can you imagine? Quicker and easier. This is wow. I bravely tried it when no one else was doing it. No one was talking about it. There wasn't anything in the literature about it at that point. And the transformed lives buoyed me through my learning curve. It was up to me. I had to. And boy, did I get great at that. This is me having the blessing of awesome mentors, finding out how to help guide adverse growth and development toward normal in 1-year-olds, toddlers, mixed dentition. And you know what? Just figuring out when is it feasible? How early can we get to it so that we get to the high growth times? When is it appropriate? When is it needed? And how is it doable? And this is me learning and sharing with you the juice, the transformational, the glorious transformational possibilities. This is real stuff, and it is my honor to share it with you. Thank you, Doctor.